All right, Montrose, it is 5 p.m. This is Distinctive Delphine with an amazing guest today. We have Amy Rowan from Tri-Country Health Network, and she's going to help us understand how to help within our community. I know that you cover so much. Amy, thank you so much for joining us. So I'm going to let you introduce yourself and tell us what you do so we know kind of the scope of your responsibility and how many people you actually help.
Okay, yeah, very good. Thank you for having me. This is exciting to get the word out. So I work for Tri-County Health Network. I'm the care coordinator supervisor for Montrose, Uray, and San Miguel counties. And what that means is with care coordination, we follow up with people who are on Medicaid, on all hospitalizations, and then we also get referrals from the doctor's offices. And we really look at social determinants of health. So what is keeping somebody from health and wellness, whether it's, do they lack transportation? Do they need food resources? Do they have housing? Are they experiencing personal safety issues, domestic violence, social isolation? And can they pay their utilities? So we work a lot with people that are experiencing homelessness. We work a lot with people that are living in poverty and a lot with the low income population to really get them connected with the resources that are available throughout the region. So not only in Montrose, but also in our surrounding area.
Very nice. So tell me more about if I am on that level, especially now. I just lost my job. I'm not sure how to pay my bills. I'm not sure how to keep my house. How do I reach out for help? I think it's such a hard thing to do, number one, but also to know where to reach out because we have so many resources, but how do we know who to contact, where to go?
Yeah, and we work with people on an ongoing basis. So what's happening during the COVID crisis time with people losing their jobs, this is what we do every day on a daily basis. So for us, we've developed resources around, if you do lose your job and you're not able to pay your utilities, who do you call? If you aren't able to pay your rent, who do you call? If you can't feed your kids because you had to pay the rent, who do you call? And our whole purpose for the care coordination is to keep people from going down and going on those wild goose chases to try to find services. Yeah. Because if you're going on a wild goose chase and you call the wrong agency, you're going to get frustrated, and then people stop looking for help, and then they don't get the help that they need.
Yep.
And so we've developed resource lists, and we work a lot with our community partners on getting people connected in the right agency the first time. And we do a lot of collaboration. We collaborate a lot with Montrose County, Delta County, San Miguel County, with Hilltop, with the food banks. And so we have those connections. So a lot of times we can give that warm handoff. So if people call looking for utility assistance, we can right then get them connected to the right resource. So that's one of our main focuses, is getting people connected to the right resource right off the bat.
And I think that's really helpful because the first thing I would look for is maybe food banks, but then they're closed, what do I do? And all the questions that come up. And so is there a phone number that I can add in the comments and make sure everybody's got?
Yeah, for the Medicaid members, they can call me if they're in Montrose County directly at 970-614-7311. If they're in other counties that may be watching this and they're on Medicaid and want to request care coordination, they can call the main care coordination number at Rocky Mountain Health Plans, which is 888-282-8801. And then they will be connected with a care coordinator in the right region that they're in. So Delta would be connected with a Delta County care coordinator, Mesa connected to a Mesa care coordinator.
And what if I'm not on Medicaid?
If you're not on Medicaid, the other options, it depends on your age. If you're over the age of 60 looking for resources, then you're going to want to call Region 10, who has the Area Agency on Aging, to
Yeah.
For families that may be looking for assistance, Hilltop Family Resource Center is a great place to start. Starting with the local Department of Human Services is also another great place to start. Because we work in collaboration, even if you're not on Medicaid, all the agencies that we work with have the same resource list that we work from. So Center for Mental Health is another good example of where to start for resources, because we supply them with the resource list that we've created on our end.
Yes, we've had a couple of guests from the Center for Mental Health, and they're doing so much for the community right now. They're really out there, and I really love it. And so tell me a little bit more. I see more and more homeless who have access to phones and specifically social media, and reaching out for help on social media directly. And I personally have such a hard time not helping if it's right there and I'm on my way and I might just swing by wherever that person is. But I personally ran into an issue doing that because number one, I'm not qualified to talk to that person who might be struggling with things that are way over my head. And also, then they just keep reaching out every morning for breakfast and then lunch and dinner. And I don't have the right resources to be able to do that every day. I try to feed my kids first, but
right.
so it was really interesting to me because even while pushing and giving the right information, because I'm lucky enough that I was in contact with the Center for Mental Health and I was in contact with you and exposed to all the resources out there, that finally after a week of kind of pushing him and saying, hey, they can really help you, he touched base with Angela today, and I really am confident he's going to get the help he needs. But it took a week, and so how do we caution people not to be generous, because we want everybody to be generous, and I always tell people where to put donations and help, but how do we caution people not to dive at first request, because some people are also not homeless, even if they claim so. And I'm not saying they all are. I'm just saying be cautious. Only because sometimes you can find yourself in a bad spot if you show up in a dark alley to drop off food. It might not be the best idea.
Right.
Yeah, and a little bit more guidance, because I feel like we have such a giving community, right? And it's so easy to tell ourselves and to make ourselves feel better about ourselves. Oh, I helped someone today. But really what we want at the end of the day is then to have a long-standing help, and not just today a breakfast, or not just tomorrow a lunch. We want them to get the help they need so they can get back on their feet, right?
Right, absolutely. And that's why one of the reasons why I, put out kind of the let's be safe about this, working, and I've done care coordination and worked with, the community for over 25 years. And we always talk about, when I'm training staff, having boundaries with our community members and making sure that we are safe going and meeting with people, because we don't know who people are. We don't know what their backgrounds are. We don't know if what they're saying on social media is true or not. So I always recommend, and we always meet with people in public places. And right now that's very difficult to do, because all of the public places that we would normally meet with people to get them resources and to help fill out applications are all closed right now. So we would meet with people at Hilltop and the library mainly, or a coffee shop. And that's not an option right now. So where do we meet with people to get them resources that can be helpful to them? And it always should be in a public, well-lit area. Even some parking lots aren't, a little bit sketchy. One of my care coordinators was asked to meet with somebody behind City Market in the parking lot back there. And I was like, no, we have to be right about this. Meeting with somebody in a park is not smart. So we have to, we have to use that caution. Normally outside of COVID-19 times, most people wouldn't invite somebody into their home to stay with them, or most people wouldn't invite somebody to come by and pick up $5 to their personal residence.
Mhm.
So we just urge you to be cautious about absolutely help people. Like, I'm not saying don't help, but I'm saying protect yourself, protect your kids. I actually reached out to Chief Hall and Sheriff Lillard today to get some of their perspective on where we're at. And Sheriff Lillard emailed me back and said, crime is up. People are starting to get into desperate times. We're going now into a second month where people may not be working and can't pay their rent, can't pay their kids. And when you're in crisis time, people that normally wouldn't do something, wouldn't steal something, crime is starting to rise because car break-ins are on a rise. Home robberies the increase is coming. So he also said the same thing. Be safe. Be safe on where you're meeting with people, on who you're talking to, on who you're giving things to, because we don't know people's situations. We don't know what they're going through. And in times of crisis, people do things that they normally wouldn't do otherwise.
Right. And I like to focus on positives. So I really love the idea of knowing that if I redirect them to you or Angela or Hilltop or Region 10, I personally know that they will get a lot more help than if I just provide them with one meal or two or even more. It's not a long-term solution. Whatever I can do to give, and if I can make them feel better, because that's what I did. I went with a hot meal to, it was getting colder. We had a colder week, and I was like, here's a hot meal for the night. And I was really, like I said, it took me a week to get that person the right contact and convince that person who was really adamant about not just ego, but I think he went through a lot of issues before and was afraid of reaching out. And now that he finally did, I truly believe he's going to get the help he needs. And for me, I find this so important to say, because that's why I'm doing this. If you're struggling to pay your utility bills or to put food on the table for your kids, reach out. Our community is amazing. We do have help out there. And does it take a little while on the phone and some information and maybe paperwork? Yes, but it will get the help you need so you don't have to go to City Market and steal some milk and bread. Like, let's just be realistic. That's really what the message I want to send is. Just reach out, because we as a community are coming together. We are giving. We are there for you. And we all know that there are months that might be difficult. But I see personally the light at the end of the tunnel. Do we still have to do social distancing? Yes, but in a week, we're going to start having more freedom. And it's going to be key for Chief Hall and everybody else to do their part. And so I really encourage anyone who's struggling right now to reach out to you, to Hilltop, to who else do we have here? Anyone really. And I'll put all the phone numbers on the comments, but let me know what else, can we do to keep this kind of positive.
And people shouldn't be ashamed to reach out for help. This was absolutely, especially those that have lost their jobs because of the social distancing, this is nobody's fault. Nobody, everyone, I shouldn't say everyone, but a lot of people are really struggling right now. So, reaching out and getting the help now to have some of those long-term securities moving forward. Like I am always amazed when I'm updating the resource list at how many organizations in our community have assistance. You're right. It does take a little bit of time to fill out a couple-page application and maybe get your bills together, but the help is there, and the agencies are ready and willing to help anybody that is experiencing difficulty right now. And we have an amazing community that really has come together. And I'm hoping what we get out of this is more long-term collaboration and not just, the short-term acute fix now. We are going to be experiencing issues. People are going to be experiencing, financial struggles for months. You figure if you lose your income for 2 or 3 months, that really sets people back.
Oh,
so please, reach out. We want people to reach out. We want people to ask, whether it's on Facebook or calling or emailing. Reach out and ask what those resources are, because we can very easily get people connected to the right resource in the beginning, and not, try to call, 10 different agencies and get no, try here, no, try here. We want people to be able to get connected right off the bat and not add to the frustration of trying to find a way to feed their kids or pay their gas bill.
Yeah, and I think also if you do it now, and then when things start picking back up, you don't put yourself too far behind that is just too hard to catch up, right? You really kind of have to step forward. And I also believe that with your point of saying the collaboration right now is so good, I don't think we'll go back to the ways things were.
I don't think so either.
Because it's such a good thing. Everybody benefits from the collaboration.
Yeah.
I find this beautiful, and I do believe that we're not going to go back to business as usual. It's so hard to go backwards when we're doing so well, collaborating and being where we are today.
Yeah. Well, and the other piece of, care coordination, case management, options counseling, case navigation, I mean, we all have so many different titles, but do the same thing, is, if somebody is having difficulty paying their rent, we look at other options to help them maybe save money in another area so they have money to pay their rent. So if somebody's having difficulty paying their rent and are paying a cell phone bill and they qualify for a free cell phone, that could put another $50 back in their budget. Or if we can get somebody connected with SNAP and get them the food benefit, oftentimes that puts $100 back into somebody's budget. So, we can get them connected with the right resources, but we can also help them strategize on how to save in one area to be able to pay in another area as well.
That's great. So it's really educating. And again, I think it's looking at the long term.
Mm-hmm.
Not just putting a Band-Aid on it, but long term, how can we help you get out of this?
Yeah, we can't Band-Aid this. This has to be a long-term fix. This has to be long-term strategies. So people in 6 months can, it may take 6 months to get back on their feet, but they have some strategies. Housing Resources right now is doing great work with doing foreclosure classes and rental classes and, budgeting classes, so that's just another avenue to help people long-term be able to maintain.
And who does that? So I can.
Housing Resources of Western Colorado, Abby Brewer.
Oh, yes. Great. I'll add it in there too. Amazing. I might have to touch base with you for all this information so I can put it all in the comments too, so everybody has it. It's really the goal of all this is to get this information out there to the community. So I really appreciate your time. What else do you want us to know?
Oh my gosh. I think just, continuing to be safe and continuing to refer people to, reach out and get help, that is going to be the new normal, is, people that normally haven't had to reach out before are having to reach out, and to make that normal, to make it okay, is going to be important too, because we know that mental health is, going up, depression is going up. And so the more we normalize that it's okay to reach out, the more we normalize it's okay to ask for help, I think the better off people will be in the long run as well.
I agree. So you've heard it from Amy. It's okay to ask for help, and we are here for you. She is here for you. There's so many people here for you. I will tell you that I am really proud to live in this community for that reason.
Me too. Yep. Absolutely.
Awesome. Well, thank you so much for your time. This was really informative for me. I'm going to put a ton of comments with all those phone numbers and the information, and hopefully we'll talk to you soon.
Okay, sounds good.
Thank you.
All right.